Broadcasting from Detroit's Cass Corridor, it's the Metro on WDET. I'm Robin Vincent.
And I'm Tia Graham. Today on the show, Michiganders are living shorter lives with higher rates of chronic disease compared to people in other states. We'll look at solutions.
Then, how can a state surrounded by fresh water still leave so many households struggling to afford the water that runs through their own pipes?
And later, Detroit painter Sidney Camp is taking apart one of the oldest symbols of beauty, the goddess Venus, and rebuilding her through a broader, more honest lens.
And finally, as climate change reshapes Michigan's landscape, planting a tree isn't as simple as it used to be. The DNR will help us choose the right tree for the right place.
Roots that wander, water that sustains, a future rising with us. This is the Metro.
We begin with something very personal, our health, which isn't just influenced by the choices we make. It's also determined by public policy. That's the message of a new report that examines the ways our health in Michigan is lagging behind people around the country. On average, our lifespans are shorter. Our infant mortality rates are higher, and we're more likely to suffer from cancer and other diseases. So why is this the case? And what is the state's role in getting us to move our bodies more and to expand our minds so we can live longer, healthier lives? To discuss how we can change these dismal outcomes, Carly Abramson joins me now. She's a health policy research associate for the Citizens Research Council, which published the report. Carly, welcome to the Metro.
Hi, thank you for having me.
You begin the report by writing that the cultural understanding of health is largely centered around the idea of personal control. But you argue that there are collective things that we do and don't do that impact all of our health. What do you mean by that?
Yeah, so what I mean by that is that when we talk about health and we talk about what people can do about their health, how they can achieve better health outcomes, we often focus on the different health behaviors and things that they can do to make different choices, to eat different foods, to exercise, to go to the doctor, to do all of those things that you need to do to be healthy. But there's a lot of other resources that you need to obtain those better health outcomes. And obtaining those resources is not as easy as just personal choice and within your own control. All of our health behaviors are largely determined by our circumstances that can severely limit or restrain the choices that we have to make further healthy choices.
So we're talking about the social determinants of health. We're talking about the kind of access that people have, access to transportation, for example, what a person's socioeconomic status is, the education that they have obtained. What are some others?
Yeah, so one of the things about social determinants of health, and one of the things that we wanted to do with this report was kind of to create a more tangible framework for it, because it really covers everything. And that's kind of the takeaway, is that everything affects your health and everything kind of seeps into these health outcomes. And so for policymakers, trying to get them to focus on this issue that is a little bit hard to kind of get your hands around just because it's so big. We divide up the concept of social determinants of health into 5 fundamental resources. So what are the essential resources that you need to obtain good health outcomes? And essentially, financial resources to obtain a lot of different things. That's kind of where the starting point is. And feeding into that is education, employment, income, all of those factors. You also have healthcare and the healthcare system as another. You need access to care. You need a service provider. You need doctors. You need medicine. You need all of those things. Food and nutrition is another fundamental resource where you need healthy foods. You need to be able to nourish yourself. We have the category of safety, which encompasses a wide range of things: violence, workplace safety, the environment, transportation issues, just those kinds of things all factor into safety. And the last part as social support, because on top of all of those things, you need there's a lot of research showing that you need to have those connections, you need social support, you need a culture that doesn't stigmatize, getting help when you need it. All of those things kind of have to come together. And there's only so much that an individual can do to tackle the barriers to getting all of those resources.
And then there are nuances to a lot of the things that you mentioned, which we're going to peel back in a little bit. But before we do that, I want to look at some of the actual findings from the report. So Michigan ranks below average in just about every major metric of health. This is not good news. From life expectancy to infant mortality and diseases like cancer. Is this relatively new, or has this been true for Michiganders for a long time?
It's been true for at least the past about 10 or so years. So we kind of were inching back up a little bit and then kind of went back down. So there was never a time where Michigan had a status that was profoundly different from what it is now. And so Michigan, we're not hugely more unhealthy than we were 20 years ago, but we are at least a little bit more unhealthy, and it's trending in the wrong direction.
Okay. And so one of the things that we can draw a straight line to is income. Michiganders' income is too low on average. And I think people understand why income, of course, matters for health. You can afford more things and make life easier for yourself. You have more time to go to the gym, to pay for a gym membership, to eat healthier food, to even focus on these things is a luxury. As someone concerned about collective well-being, what do you want Michiganders to be paid on average for our health outcomes to improve?
That is a very good question and beyond my scope of expertise to be able to kind of give a number to that. And one of the things about this report, we are a nonpartisan agency. And so, as you said, a lot of people, it's very easy and obvious to understand the correlation between income and health. But for a large section of the population, it's not that easy to understand. It does need to be kind of laid out why this is important. Again, because we focus so much time and energy on individual choice. And so making this concept available and accessible to people who this doesn't actually come naturally to think about these kinds of things, which includes a lot of our policymakers as well. And so this report leaves open potential policy solutions on both sides of the aisle to try to contribute to this fundamental problem, because we at least have to agree on what the problem is before we can come up with solutions. And different experts from different fields will have those conversations about income and minimum wage, and other people will talk about economic development, and maybe we should focus here and here and here. But the goal of the paper is to get people to kind of at least agree that this is the problem, and then leave it up to the experts to come in and talk to each other about those potential solutions.
And when you're talking about folks who you say might have a hard time drawing that connection, I'm guessing you're talking about people who make a lot of money, who maybe have not struggled in their life. And so this is not front and center to them to make that connection.
Correct. Yes. People, it's a little bit hard to understand why you can't just make the healthier choice. Why can't you just cook instead of order fast food? Those conversations are still happening with, a lot of different pockets of the population. And so laying that out, especially in a very fact-based way, we're not an advocacy organization. We write and research based on facts. And so laying that out for people, both policymakers and the general public, was actually something that was very much needed for large portions of the population.
The importance of education and getting a college degree. We have briefly mentioned that. Why is that so important for health outcomes?
So the correlation between education into employment, into income, into health outcomes. And so education is one of the building blocks of maintaining an income that will enable you to make the right healthy choices. The data, between education and employment rates, education and income shows, the more educated you are, the higher your income. Like that's the general trend, right? So making sure that our education system and all of that kind of education policy is enabling everybody across, different backgrounds and the socioeconomic status to be able to obtain that education, to at least be able to enter into adulthood with the ability to earn an income that will give them better health outcomes.
Now, college graduates and people with higher education, they are going to tend to have better health than those who don't. That's what you're saying. But I'm wondering, what do you make of a person who has a higher education degree but a fairly low income? Do they have better health outcomes than someone with very little education but a higher income?
So there really isn't much data to show that just there's anything about having a high education itself that would lead to better health outcomes. It's that pathway from education to income that then enables you to have access to all the other resources. There isn't much, I think, either in data or even in a theory as to why more education itself without connected to a higher income or a different kind of lifestyle would lead to better health outcomes. Because there's even if you're educated, that's different than health education and understanding healthy choices. You can be very educated in a certain field and still not necessarily understand healthy choices and health education.
So it's all about income is what we're saying here, because the higher education leads to the higher income more typically.
Correct.
This is the Metro on WDET. I'm Robin Vincent. I'm speaking with Carly Abramson. She's a health policy research associate for the Citizens Research Council. We're discussing a new report that shows health outcomes for people in Michigan are lagging behind those nationwide. Now, Carly, if you turn to social media or the latest podcasts, you probably hear a lot about how your health is in your control. Health is wealth. Whether it comes to podcasts from, say, Joe Rogan or Jillian Michaels, people sometimes believe they have complete control over their health. Let's hear from those two right now.
What we know, what you can do for what you are right now, where you are right now, that if you change your diet and you eat healthier foods and you exercise, you'll feel better, you'll be better.
Your health is your primary wealth. We say you got to be the CEO of your health. 100%.
You have to be the CEO of your health. What do you make of the perspective that someone's health is so fully in their own hands and they ultimately are responsible for how healthy they are?
It's, partially true. There is always personal agency. Personal control and responsibility is always a factor in every outcome. But what the data really shows is those correlations that different segments of the population, particularly based off of income and wealth, tend to be healthier. And so the question of why that is, right? There are people who want to get into that conversation of why some people are able to make the right choices or have better income and why other people are not. But what the data shows is that correlation exists. And what is the more kind of documented framework for this is all of those barriers that exist when you don't have the financial resources to get the things that you need. And so even we think about normal things like transportation and access, but even just time and stress-free time. Yeah. When you're talking about prioritizing your life and your decisions, or if you're just under enormous stress, a lot of times because of, poverty and food insecurity, those kinds of issues are really going to limit what you're going to prioritize in the moment to be able to make those healthy choices. So it's in your control, but so many things are restraining you and so many things are limiting what actual reasonable options are actually available to you. There's the theoretical options, and then there's in your daily life, what is an actual reasonable decision for this person to make at the end of the day?
Yeah. I mean, you're talking about the true costs of poverty, the costs of time, the costs of the emotional taxation, the mental anguish of that. But still, there are going to be people listening right now who say that by exploring the social determinants of health and not discussing individual choices, people will believe that the decisions they make about their health are not their own, and therefore they don't have much agency in improving their health by doing things like exercising and eating healthier foods. What would you say to that?
I would say that, there's always, you're always in control of your own behavior. But also, as far as it, comes to obtaining better health outcomes, people also have agency in interacting with policymakers. We are connected to our institutions, and one area that we measured in the social support segment was voter turnout and civic engagement. Michigan does kind of moderate in those areas. But in addition to those choices we make individually, we have choices about who we elect and the institutions that we create, what kind of policies that we want. And so there is a lot of agency and empowerment in not only making those choices for you, but then also thinking about what kinds of barriers do you want our policymakers to focus on, and trying to get that involvement and focus on, when you decide who you want to elect and who you want to vote for, that is an avenue that will also directly impact your health.
My guest is Carly Abramson. She's a health policy research associate for the Citizens Research Council. And we're discussing a new report that shows health outcomes for people in Michigan are lagging behind those nationwide. And so, Carly, that has me wondering, of course, which states are doing the best in terms of health outcomes.
So we compared Michigan to the national average, and then we compared Michigan to, 5 or 6 neighboring states. So we didn't do like a thorough state by state ranking, who's doing better, who's doing worse. And it's difficult to make those kinds of direct comparisons because there's so many differences in each state. And there's just so many different variables that, depending on which particular measure, you can say this state's doing better or this state's doing better. But it's hard to make that overall assessment of like which state across the board has most of its, we wanted to focus mostly on Michigan at first to just assess how behind are we, and in particular, compared to states that are relatively similar to ours. Because if they can do it, then we should be able to do it. But if you're comparing Michigan to California, or there's certain comparisons that aren't actually beneficial or as beneficial for Michigan to focus on because the structure of other states is so different that we might not be able to apply it here to Michigan. But our regional sister states, we should be able to match at least what they are doing.
I mean, it does strike me. Most recently, I was living in Colorado, and that is a state with a lot of sunshine, and it is a place where people are active and they're outdoors a lot because of that sunshine and because of the more forgiving weather there, the lack of humidity. And I notice here in Michigan, it takes a lot more effort for me to be healthy. And when I say be healthy, I mean to be active. I understand how much exercise is inextricably linked to our health, and I have to make a plan here. I mean, on a day like today, it's going to mean going to the gym. What does that mean for someone who can't afford the gym, or for someone who is working 3 jobs today, who's not going to make it to the gym after a very long day, after they're completely exhausted? So I'm guessing that our geographic location, the unforgiving weather, the long winters, the lack of sunshine is really playing a role here too.
Definitely, not just Michigan weather, but the kind of varying structures and kind of built environments that vary widely across the state as well, because we've got urban and we have rural, and there's a lot of different barriers just kind of within the structure. That includes weather and climate, but that also includes how walkable is the area, how close are things, is it safe, is it, are you comfortable just walking outside, and
right.
And there's so many different factors in that would require potentially different targeted solutions, whether you're in a rural or an urban place, those barriers are going to look different, but those barriers still exist. And right now, the only way to navigate yourself through those barriers, no matter where you are, is with money. That is, we have some kind of programs that are targeted toward individual things, but to put yourself in a safer community, to be in the kind of neighborhood that you want, we can't in Michigan, we can't buy our way out of weather.
Right.
But, a lot of those other barriers, right now, the only tool that you have is to buy your way out of those.
Right. To be able to walk in a neighborhood at length where you feel safe.
Mm-hmm.
That is going to depend a lot on income. I mean, I will say, I think it's worth noting the investments that the city of Detroit has been making into its park system and how important that is for folks' health and how much safer some of our neighborhoods feel with some of those parks. So it seems like that is, when we're talking about good public policy, that's something that we should be encouraging more of.
Yeah, and there's a lot of there's a lot of branches that you could work on, and that's what a lot of public policy about in kind of the health policy field is finding those barriers and kind of picking away. And what we are attempting to refocus policymakers on is the root of it. And from all of those branches, the root of it, without changing our whole healthcare system, because there's only so much we can do at the state level, right? The root of the problem is that income, financial resources, employment, education. And so it's not that picking out those other branches isn't worthwhile, but if we're really trying to make a change about health impact, we go to the root of the problem. And the report lays out why so many of these things connect back to that root and trying to get policymakers to focus on that origin.
Carly, I have a tough question for you to close things out. If tomorrow we could do one of three things, here are the three options. We either give every Michigander health care through a public option, we give them $10,000 more every year, or we give them free college tuition. Which one do you think would make the most dent toward a resident's health?
I will speak to what I know there to be the most research on. So all of these, we are a fact-based think tank, and my answers are largely based on what I know to be true from the research. And there is research supporting, all three of those options.
Yeah.
I think there's more of the overwhelming research shows the health benefits of getting people insured. And so that is, if I had to pick. But that's not to say that those other things wouldn't contribute or potentially make a huge impact. Not enough states and policymakers have implemented those for us to really know the data on the long-term benefits of those types of solutions. And so there's data to support them, but we can't say kind of long-term how much of an impact. But we have it very clear in the data, when you get people covered and you get people insured, the health outcomes improve. So that's where we have the most evidence for. So that, that's what I can say about that. I don't know what I would pick, but that is what the research supports. Getting people insured is what you need.
Carly Abramson is a health policy research associate for the Citizens Research Council. Carly, thank you so much for joining me on the Metro.
Thank you for having me.
It's the Metro on WDET. Coming up, we examine how a state surrounded by fresh water became a place where so many households are living with rising water bills, shutoff notices, and long waits for relief. And we'll look at what advocates say needs to change now. It's the Metro on WDET. Stay with us.